Hi friends, I brought a new video for you. This video is going to be on Getryl. Getryl has 3 milligrams of Glimepiride in it. The box has 20 tablets. It's made by Pharma. The price for the box is 303 rupees. Glimepiride is used along with diet and exercise and sometimes with other medications to treat type 2 diabetes, condition in which the body does not use insulin normally and therefore cannot control the amount of sugar in the blood. Glimepiride lowers blood sugar by causing the pancreas to produce insulin, a natural substance that is needed to break down sugar in the body, and helps the body use insulin efficiently. This medication will only help lower blood sugar in people whose bodies produce insulin naturally. Glimepiride is not used to treat type 1 diabetes, condition in which the body does not produce insulin and therefore cannot control the amount of sugar in the blood, or diabetic ketoacidosis, a condition that may occur if high blood sugar is not treated. Over time, people who have diabetes and high blood sugar can develop serious or life-threatening complications including heart disease, stroke, kidney problems, nerve damage and eye problems. Taking medications, making lifestyle changes such as diet, exercise and quitting smoking, and regularly checking your blood sugar may help to manage your diabetes and improve your health. This therapy may also decrease your chances of having a heart attack, stroke or other diabetes related complications such as kidney failure, nerve damage, numb, cold legs or feet, decreased sexual ability in men and women, eye problems including changes or loss of vision or gum problems. Your doctor and other healthcare providers will talk to you about the best way to manage your diabetes. Glimepiride comes as a tablet to be taken by mouth. It is usually taken once a day with breakfast or the first main meal of the day. To help you remember to take Glimepiride, take it around the same time every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take Glimepiride exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Your doctor will probably start you on a low dose of Glimepiride and gradually increase your dose if needed. After you have taken Glimepiride for some time, Glimepiride may not control your blood sugar as well as it did at the beginning of your treatment. Your doctor may adjust the dose of your medication as needed so that the medication will work best for you. Be sure to tell your doctor how you are feeling and if your blood sugar test results have been higher or lower than normal at any time during your treatment. Glimepiride helps control blood sugar but does not cure diabetes. Continue to take Glimepiride even if you feel well. Do not stop taking Glimepiride without talking to your doctor. This medication is sometimes prescribed for other uses. Ask your doctor or pharmacist for more information. Before you start to take Glimepiride, ask your doctor what you should do if you forget to take a dose. Write these directions down so that you can refer to them later. As a general rule, take the missed dose as soon as you remember. If it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. There are some side effects of Glimepiride which include dizziness and nausea. Some side effects can be serious. If you experience any of these symptoms, call your doctor immediately. Yellowing of the skin or eyes, light colored stools, dark urine, pain in the upper right part of the stomach, unusual bruising or bleeding, diarrhea, fever, sore throat. Glimepiride may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. I hope you like the video. Please like and share our channel. Subscribe to our channel. Thank you.